All of us have worked very hard, and all of us came into this to help our patients. As a nurse practitioner, whether you are a medical doctor, a DO, an NP, a PA, a business owner, every one of us have been through years of education. Whether it's the School of Hard Knocks or it's lots of degrees, all the years of education, the skill set, we want to make sure we're doing what is absolutely best for our patients. We've worked hard for the reputation that we've earned through the years of training, all of these things that we've worked through. And so how do we fulfill our purpose, which is helping our community? How do we bring in the latest technology, whether it's longevity type treatment, or it's regenerative medicine, or it's a combination? And how do we maintain that strong reputation with our community that we've worked so hard? From a legal aspect, from the how do I have the best protocols? How do I know which protocols to use for specific patients with specific types of treatments? One of my favorite things when I'm training is the person in the room that knows everything. That's who scares me the most. I think it's really important to always be learning and gaining knowledge, whether you own the practice, whether you are the licensed medical provider delivering the services. All of us can continue to learn and sharpen our skill set, gain the confidence that we need. So whether you own the practice, whether you are the licensed medical professional, or you wear all those hats, it's so important to be connected to a team of experts to help pull you through bringing in new treatments. What is the research? How do I do this from a technical skill set standpoint? What are the legal ramifications? How do I communicate this with my staff? How do I communicate this with my patients? At the end of the day, we all want to help our community. If you have any questions about the video, comment below. We will be happy to answer them.